Influenza, or more commonly known as the flu, has the largest impact on our healthcare system of all infectious diseases, accounting for 30% of the total burden. The problem with the word influenza is the misconception of its meaning. When people get a cough or cold, we moan that we have the flu, a mistake which means we don't take the real flu seriously. In the last year alone, this disease has taken the lives of 1,100 Australians. Influenza has more severe symptoms than the common head cold, including body aches and pains, fever, chills, and tiredness, as well as typical cold symptoms. When left untreated, the flu can lead to life-threatening complications such as pneumonia, seizures, and premature labour. A group that is often overlooked are the Aboriginal and Torres Strait Islander Australians who are at an increased risk of influenza and its complications. In particular, pregnant Indigenous women are an extremely vulnerable group with only 16% vaccinating within 12 months of their due date, and as such need special attention. To begin closing the health gap, we need to work with communities to protect mothers and babies. But why is this? Biologically, there is a higher level of co-occurring diseases in Indigenous women with higher rates of respiratory conditions such as asthma and COPD, which worsen flu outcomes. There is also social impacts such as the higher level of mobility, overcrowded living conditions, poorly constructed housing, lack of cultural awareness in the medical profession, and limited information on the vaccine and why it is needed. For Indigenous women living in rural and remote communities, women often have to travel extensive distances in order to receive the care they need. However, it is important to prioritise the health of both the baby and the mother and acknowledge that the benefits outweigh the potential costs that this disease has on the community. Some of the pros that the vaccine entails is that it is free, it is safe for use, it is available throughout pregnancy but recommended prior to conception or as soon as pregnancy is detected, and provides immune protection for babies during the first 6 months of life and not just in the womb. Some common misconceptions are that the vaccine can give you the flu or that it can cause autism. But research has shown that this is false and the flu vaccine is in fact completely safe for the mother and child. Although the government needs to invest more money into rural healthcare such as mobile clinics, there are some precautions you can take. Get your flu shot this season, as this is the best protection you can give your baby and yourself. Encourage your friends and family to get vaccinated, especially if they are pregnant as well. Together, we can create a stronger, healthier community.